We're going to finish up glucocorticoids by talking about contraindications, a little bit more about the side effects, and a couple of disease conditions that we can create with steroids. So, contraindications for glucocorticoids. Anything that's undiagnosed, we need to know what we're treating in order to properly use glucocorticoids. And the reason for that is this second bullet item, fungal infections. In certain parts of the country, we have soil-borne fungal infections that animals get by breathing in the spores from the fungus. I'm thinking of valley fever in the Southwest and in the Mississippi River Valley. There's histo and blastomycosis infections. And these infections, if you give an animal steroids, if they have a fungal infection like these, they will go to a lot of organs in the body, and it will be very difficult to treat it after the fact. So we need to be sure that we know what we're treating. Obviously, that's the job of the veterinarian, but we don't want to casually give glucocorticoids. Because glucocorticoids can suppress the immune system, you may wonder about this question about vaccinating animals. Normally, with regular doses, as in really just the immuno or the inflammatory doses, anti-inflammatory doses of glucocorticoids, we can safely vaccinate animals. They'll have enough of an immune system to mount the reaction to the vaccine. The exception is if we are giving a modified live virus vaccine to an animal that is on supraphysiologic or very high doses of steroids. They should not be vaccinated at that time, and not with the modified live. Modified live needs a very competent immune system to work. So that would be the exception. But most of the time, animals being treated chronically for allergies with steroids, and hopefully they're not on really high amounts of them, they can be vaccinated. If you have any questions, you ask the veterinarian. When animals get eye injuries, we always check to see if they have an ulcer, if that top layer of the cornea has been removed. And the way that we do that is with a fluorescein stain test. And you guys will get to do that next semester. And this stain, it goes in orange, and we touch the little paper with the stain on it to the eye, and then we flush out any excess, and we look at the eye under a black light. And that light will, if there's an abrasion of the cornea, if that top layer is removed, the layer underneath it will stain a green color. It's kind of magical. And that means that we should not put a steroid in the eye of that animal. Normally, if we have an inflammation of the eye and there is no ulcer, and the cornea is intact, then we can go ahead and give it a steroid to just calm the eye down. But if we were to give a steroid into an eye that has that abrasion on the cornea, it's going to make that ulcer progress. And we can get what's called a melting ulcer, where the entire cornea melts down and we get a rupture of the globe. So that's why we always stain, look for that ulcer before we give a steroid. Preparations, ophthalmic preparations, always have a red cap on them if they have a steroid in them to sort of alert you, hey, be sure that this is what you want to give the animal. Pregnant animals, I've talked about that glucocorticoids can induce parturition or cause an abortion, so we don't want to give steroids except maybe a topical to pregnant animals. And horses and laminitis. Laminitis is an inflammation of the lamina of the hoof. Any hoofed animal can get laminitis. Horses are very prone to it, and horses tend to be kept in areas where there can be high amounts of grain. And if they get into a grain bin, this can lead to laminitis. And in the extreme, what happens is that lamina becomes so inflamed that the outer part of the hoof starts to separate from the inner part along that lamina. As much as you might think that's an inflammation and we should treat it with a steroid, we don't do that. It just makes it worse. So we don't use it with laminitis. This is an example of a horse that is in an extreme laminitic condition. It can hardly step. The feet are so painful. It's being suspended so it doesn't have to put much weight on the feet. This farrier is probably trying to trim the hooves to make it so that the horse can stand comfortably. So you'll learn more about laminitis, but we don't treat it with steroids. Immature animals, it interferes sometimes with growth, and so we don't want to give immature animals, except maybe topicals. Again, I have a little caveat about topicals, but we don't want to treat them with systemic steroids. And then lastly, liver disease. Giving steroids systemically will cause a change in liver enzymes. So we need to be aware of that whenever we're interpreting any blood work where we're looking at those liver enzymes. If they're elevated, one of the first things to ask is if the animal has been given steroids. And so we want to be careful with that and liver disease. So some other things, Cushing's disease. Cushing's disease is hyperadrenocorticism. So we can give an animal a version of Cushing's disease. We call that iatrogenic Cushing's disease. What that means, what iatrogenic means, is it's caused by humans. We are the ones who are creating it. It's not a natural disease. I'm going to lower this down so you can see this last little item. And by administering too many steroids, we can cause a version of Cushing's disease in an animal. The clinical signs are, again, my little friend here, Homer Simpson. So clinical signs would be bilaterally symmetrical alopecia, so hair loss. It looks the same on both sides. And it's typically in the flank area of animals is where we see this bilaterally symmetrical alopecia, not on the scalp like Homer. Pot belly and thin skin. So pot belly from the atrophying of those abdominal muscles. And then animals that have Cushing's disease or have been given too many steroids will want to eat a lot. So that's called polyphagia. They'll want to drink a lot. I could put a beer in Homer's hand here, but animals aren't drinking the beer, they're just drinking water. So polydipsia. And then they will also urinate a lot because they're drinking a lot. So that's polyuria. So all of those things are signs of an animal with Cushing's disease and also an animal who's been given too many steroids for too long. The drinking and eating and all of that has to do with antidiuretic hormone and interference of that. So we want to be sure that we're aware of that when we're looking at an animal that's being treated for allergies long term with steroids. And I'm going to talk more about Cushing's disease in a minute. GI clinical signs. So something that if you go back to that inflammatory cascade, we had an interference of prostaglandins. It was kind of far down on the cascade, but it basically was prostaglandins cause a protective layer of the stomach. And so if we're inhibiting prostaglandin formation, we inhibit this mucus formation and a reduction of the acidity of the stomach, and that can lead to gastric ulcers. So something very important that we need to watch for in long-term glucocorticoid administration. So immunosuppression, if animals are on this long-term. The other thing that goes along with Cushing's disease or giving glucocorticoids for too long are infections, and typically they're bladder infections. That's an animal with recurring bladder infections and these other signs. If they look like Homer, we might have a Cushingoid animal. Diabetics, I talked about the increase in blood glucose and the suppression of insulin. So we need to be careful in giving glucocorticoids long-term to diabetics. In a short term, there may be no big consequences, but long-term, the owners might have to change their insulin doses that they're giving the animal. Pregnant animals, I've gone over that, so sorry, didn't mean to go that far. And then lastly, problems with topicals. So the problem with topicals is that if they're given too long and if they're given with orally administered glucocorticoids, they can really cause a problem. And sometimes owners think a little is helping that ear infection, so I'm just going to do this 5 times a day. They get over exuberant with a topical, and that can be absorbed and get into the systemic circulation and can suppress the adrenal glands. So we need to be careful with especially combining topicals with orally administered glucocorticoids. All right, so I'm leading up to this discussion, and we can actually cause both Cushing's disease or Addison's disease with the administration of glucocorticoids. How does that occur? It has to do with that negative feedback loop. And I'm calling your attention to this word, iatrogenic. So this is human caused. We are causing it. It's not naturally occurring in the environment. It's just kind of a consequence of what we're doing to the animal using glucocorticoids. So with Cushing's disease, so that's hyperadrenocorticism, I think you can figure out that if we administer too many steroids, we're going to start making that animal look like they are producing an overabundance of steroids. And they will have all those symptoms we talked about on the last slide. They will look like Homer Simpson and all of those symptoms. So when we think about Addison's disease, Addison's is hypoadrenocorticism. We're not producing enough of the steroids coming from the adrenal gland. So how does that occur? Well, it occurs because of this feedback loop. If we are giving too many steroids, so this is cortisol is a naturally occurring kind, but we are dumping in essentially because we're giving this animal a lot of these steroids, it's going to give negative feedback. It's going to tell the hypothalamus to stop producing this hormone, corticotropin releasing hormone, and it's going to tell the pituitary to stop releasing ACTH. That's going to cause the adrenal gland to stop producing cortisol, natural cortisol. We've got plenty in the system. It's being provided for us. The adrenal gland starts to atrophy. If, and this is the next very important step, if we take an animal off of glucocorticoids suddenly, that will leave that animal being an Addison's patient, because their adrenal gland will be essentially non-functional. It has not had to be used. It's just sitting there. It cannot ramp up production of cortisol fast enough. So what we need to do with steroids, if an animal's on them long term, we want to slowly taper them off. So we might go to twice a day administration, and then back that off to once a day administration, then every other day administration, and we'll carry it out for several weeks. That allows the adrenal gland to gradually ramp up production as the amount of steroids is being lowered in the body. It starts that adrenal gland back up, but it just needs a week or two to get going again. So that's how we avoid making an animal an Addison's patient. So to kind of conclude this, if we can use another drug to do the same thing, and we're going to talk about the other drugs that we might preferentially use when we talk about NSAIDs, we want to use that instead. Cushing's and Addison's are pretty serious disease. And the other side effects that I talked about, some of them are pretty serious as well. We want to use the smallest dose possible and start reducing that dose as soon as possible. If we're just reducing inflammation and then we can start tapering it off as the animal heals, that's what we want to do. We want to avoid continuous use. Alternate day therapy allows the adrenal gland to stay active. And short acting is preferred over long acting because of that effect on the adrenal glands. So those are the principles of safe use of corticosteroids.